Good afternoon. My name is Hannah Cross, and I have chosen to speak to you today on the topic of common vocal injuries and some ways that we as choir teachers or private voice teachers can help treat them. I chose the title, There's Something Wrong, because this is the phrase I used a lot before I received my vocal injury diagnosis. In July of 2021, I experienced a vocal injury while singing in the praise team at church. Looking back at it now, I'm fairly certain it was severe laryngitis, but the problem never really went away. Several months later, I saw a local ENT who wrote me off. He thought it was reflux, even though I had no reflux symptoms. The anti-reflux medication he gave me actually made my symptoms worse. Finally, I was able to receive a referral to the Voice Center at UAB Hospital, and quite frankly, that referral changed my life. On August 1st, 2022, I had the first stroboscopy that was viable, meaning that the doctors could clearly see my vocal cords and the mucosal wave. I was able to see what Dr. Simpson had theorized at. I had some sort of lesion, in this case, still forming bamboo lesions, here and here. He asked me all sorts of questions about other parts of my body, particularly my joints, and then sent me to the rheumatology department right across the street. He also set me up with voice therapy. In October of 2022, I was diagnosed with rheumatoid arthritis, lupus, and Sjogren's syndrome. All three affect the voice, but it was the RA causing the bamboo lesions. I began immunosuppressants immediately, and by the time of September 6th, the bamboo lesions had fully formed. You can also see visible chinks at the front and back of my vocal cords. These lesions were impeding complete adduction. You can see the fully formed little bean-shaped yellow, pale yellow bamboo lesions here. This chink here is not supposed to be here. This one is, but it's larger than it's supposed to be. I began voice lessons in January of 2024 for many reasons. You can now see on this March 8th stroboscopy, the most recent, that the lesions are dissipating, due in part to the weekly voice lessons with Dr. Sarah Wee. Continued immunosuppressant therapy is the other part. The chinks are still present, and I don't know if those will ever fully go away. Here you can see the little bean sprouts, the bamboo lesions stretching out a little bit. They're still yellow, but they're starting to dissipate, go away. They're no longer fully formed into little bean shapes. The chink is still here. I still very much run out of breath on long phrases when singing because of that chink, and this one is too big. This is why I chose this topic. It is extremely important that choir and voice teachers be equipped with basic knowledge of vocal injuries and what they can do to help treat them. There are things that we have been trained in that speech-language pathologists and otolaryngologists haven't when it comes to vocal health. The aim of this presentation is to equip you with knowledge of some of the most common vocal injuries. But first, let's look at the important difference between a singing voice specialist and a speech-language pathologist. Singing voice specialists are trained in vocal pedagogy and performance and can work with a medical team. Most of us choir and voice teachers are not singing voice specialists, but there are still some things we can do, and we'll discuss those later. Just like us, though, singing voice specialists can hear subtle things in the voice and have a thorough understanding of vocal pedagogy. The biggest difference between them and us is their medical knowledge and experience. Speech language pathologists focus primarily on the speaking voice. They are trained in vocal hygiene, relaxation techniques, breath management, and abdominal support. They can be particularly helpful for singers because what they teach for speaking, proper support, relaxation, and voice placement, can easily cross over to singing. Combine an otolaryngologist, a singing voice specialist, and a speech language pathologist, and you've got yourself a highly effective and potent team. Now, let's take a look at some of the most common vocal injuries. Laryngitis is an inflammation of the larynx that can be caused by overuse, irritation, or infection. It's most common after or during prolonged singing with no proper rest, and when singing loudly or with too much force without proper support. You can see in the picture to the right an illustration of healthy vocal cords versus inflamed vocal cords. It's important to note here that it isn't solely the vocal cords that are inflamed, it's the entire larynx. Some common signs or symptoms are early vocal fatigue, more forceful singing, difficulty with high pitches and soft dynamics, unexpected breaks in the voice, and unexpected breathiness when singing a glissando or a legato line. When the vocal cords are swollen, two major things happen. Number one, they do not close completely, allowing extra air to escape. And number two, they vibrate more slowly. You can see healthy abducted vocal cords on the top picture, while the bottom picture shows inflamed abducted vocal cords. The false or secondary vocal folds are also inflamed and swollen, as opposed to these ones here that are healthy. Treatment for laryngitis is much the same for any other swollen body part. Rest. Vocal rest, voice re-education with an emphasis on injury prevention, hydration, and mucolytics. If someone is experiencing laryngitis and they must continue singing to finish a show stint or something similar, a steroid can be used or prescribed, but this should only be done for the short term. Reflux laryngitis is caused by stomach acids and sometimes food particles coming back up the esophagus and irritating the larynx, as seen in the picture here. You can see everything coming back up, and our larynx is right here. Many of laryngitis' symptoms remain, and we add hoarseness, chronic throat clearing, excessive phlegm, and pain with singing. If left untreated, reflux laryngitis can cause a loss in vocal range, permanent voice changes, and the development of mucosal abnormalities, some of which we'll cover in just a few minutes. Reflux laryngitis paired with vocal overuse can lead to vocal fold lesions. Stroboscopies show swollen and sluggish vocal cords, a reduced fundamental frequency, and ulcerated vocal fold edges. You can see in this picture here how aggravated the larynx is from the acid. You can also see the beginnings of ulcerated vocal fold edges here and here. Treatments for reflux laryngitis include vocal rest, hydration, careful mucosal treatment, and acid suppression. But one of the most important and effective treatments is aggressive nutrition management. If the larynx looks this bad, imagine how bad the esophageal sphincter and the stomach look. This is a great place where a food journal would come in handy to help identify foods that cause these problems, that cause the reflux. There are three main types of vocal fold lesions: nodules, polyps, and cysts. Nodules are probably the most feared type, and as such, the term nodules is rarely used if possible. These are difficult to diagnose or diagnose accurately without a stroboscopy. A scope for nodules will show symmetric swellings on either vocal cord. These swellings happen at the point where the maximum amount of phonotrauma happens. In the top two photos, you can see the comparison of unaffected and affected abducted vocal folds. In the bottom left picture, you can see correctly adducted vocal folds as contrasted with the affected vocal folds that remain in an open phase hourglass shape even when adducted. There's a posterior chink that leaks excess air, and the sites of the nodules are often keratotic or thickened. The hardness of the nodules helps determine the treatment. Soft nodules can usually be effectively treated with vocal rest. However, stiff nodules will require prolonged voice therapy or rehabilitation. This is why stroboscopy exams of all lesions are important. They identify the proper type of treatment. The treatment for vocal nodules is voice retraining with a voice therapist and/or surgery, but that's rare. The second type of vocal fold lesion is a polyp. This is usually caused by some sort of vocal injury that was possibly related to a vocal hemorrhage and is the most common type of lesion found in men. Among other things, vocal polyps cause an asymmetric vibration pattern and reduce amplification. The affected vocal fold may even lag behind the unaffected one. Pedunculated polyps, polyps that are connected by a thin stem-like peduncle, are usually treated with surgery. This polyp in this picture is fibrotic in nature. You can see the beginnings of irritation on the opposite vocal fold right here. This picture here is of a hemorrhagic polyp. This one will most certainly be taken care of by surgery. Symptoms and characteristics of vocal polyps are hoarseness, breathiness, with a decrease in dynamic range and vocal intensity, and a decrease in flexibility and elasticity of the free edge of the vocal fold. This and this is the free edge of the vocal fold. It isn't just prior vocal injuries that cause polyps. It's also environmental factors, the main culprit being cigarette smoking. Treatment, then, is obvious: cessation of smoking, removal of other environmental irritants, voice therapy, and usually surgery. The third type of lesion we'll look at is the vocal cyst. These are caused by vocal abuse, plain and simple. They have a high rate of incidence in students and teachers. Symptoms include hoarseness, submucosal swelling that can only be seen via stroboscopy, and rigidness in the affected vocal fold. Edema on the opposite fold is also frequently seen. The only treatment for cysts is vocal surgery, as shown here in the bottom photo. Of course, voice therapy and retraining will be needed after the vocal folds have healed, but cysts do not respond to non-surgical methods. Just as an aside, I think it more prudent to be fearful of vocal cysts than nodules. Nodules, at least, can be treated with therapy. So what can you do? How can you help? You're not an otolaryngologist or speech-language pathologist. You're just a classroom choir teacher or voice teacher. Well, there are plenty of things that you can do to help treat these common injuries. Well, except for cysts. All professional voice users experience some sort of irritation or injury, but Due to the great artistic demands placed on them, actors and singers are at greater risk of an injury. Great care must be taken by them of their voice. Excellent coaching must be employed to help maintain good vocal health. This quote from The Singer's Voice sums up the importance of voice therapy. Voice therapy is the primary management strategy for the treatment of benign laryngeal lesions in singers because of its conservative nature and because it potentially lowers the risk for future problems. So then, the ideal vocal therapy program is one that includes vocal education, psychodynamics, and voice training with the help of a singing voice specialist. While you may not be a quote unquote singing voice specialist, as defined earlier, you are certainly an educator and know a thing or two about singing. The remaining few slides will deal with a healthy vocal classroom and studio, things we all should be doing, but maybe just need a reminder of. We start with posture demonstrations. If you are unfamiliar with proper singing posture, this book, What Every Singer Needs to Know About the Body, is a must-read for you. We will not discuss proper posture here for the sake of time, but this book is an excellent place to start. Breathing exercises are absolutely crucial in teaching the proper singer's breath and in increasing lung capacity. The exercise that I'm about to demonstrate for you is one that my students loved so much that we frequently made a competition out of it. So to do it, it's quite simple. You start by breathing in through your nose a nice deep singer's breath for 4 counts, and then you breathe out on a tss in a continual stream of air starting with 8 counts. Once you get to the end of 8 counts, you just blow the rest of your air out. The whole point of this exercise is to keep a continual stream of air going. Once your students get comfortable with 8 counts, then you increase it by 4. Once they're comfortable with 12, increase it by 4. Once they're comfortable by 16, carry on, So here we go. So here's a demonstration. 1, 2, 3, breathe in. So that was an 8 count. Let's do a 12 count real quick. 1, 2, breathe in and easy breathing exercises. There are ways that you can adjust that to fit your class, your students, as needed, but that's a good basic one. Anytime you exercise, you warm up. The same should be true for singing. Having a good warm-up and several good warm-ups is crucial to taking care of the vocal folds. 3 simple ones are demonstrated here, and for the sake of time, we won't do a lot of each of them. We'll do probably just one demonstration of each one and move on. So the first one I like to start with, I call the closed mouth hum. To get the proper shape of your mouth, I tell the kids to open your mouth and have the jaw parallel to the floor, then close your lips. They should just barely be touching. Then you're going to hum starting on do, go up to mi, up to sol, back to mi, down to do. And you do this in a major key. Once you've done that, you move up by half steps. Work your way up the keyboard by half steps. So we're just going to demonstrate real quick. So it's going to go okay, and you move up a half step. It's just something simple. It doesn't even have to sound all that great. They're just warming up the vocal cords. The second one I do immediately after closed mouth hum is called yawn falls. All they do from the difference in the mouth placement and shape from number 1 to number 2 is just open their lips. That's all they do. The jaw is still parallel to the floor, and they start on ah, on sol, and go down to do. And we start that on C5, the C above middle C, and we go ah, nice and smooth, and we work our way back down the keyboard. So we've started warming up our vocal cords by going up the keyboard, and now we're going to come back down. Now this third one, the balanced onset, is one that I learned in college. My choir director used this quite frequently. And this teaches us how to get what we call a balanced onset, to get the right amount of muscle closure of the vocal cords and the right amount of air closure rushing through to cause the vibration in a healthy way. Now this one, it takes a while for the students to get that balanced onset, which is why there are three steps to this one. So the first step you start off with, if you start in a middle range of pitches, you're going to start with the vowels e, o. If you start in a low range of pitches, the vowels are going to be e and u. If you start in a higher range of pitches, the vowels are going to be a, o. So low pitch is closed vowels, high pitch is open vowels, and the medium pitches are the mixed vowels. So this one, you alternate e, going from sol down to do, with space in between each one. And you want a nice balanced sound. You don't want it too airy and you don't want it too forceful. So you want it something kind of like this. Just something simple. And then you go up or down by half step, on the keyboard. Adjust your vowels as you get to higher or lower pitches. Once your students are comfortable with that and are producing good balanced onsets, then you move on to B. The first half is the same. The second half, when you end on the e on do, you slur back up to sol, back down to do, back up to sol, and back down to do. All on that e, or whatever vowel you ended on. U or o, either one. No, I'm sorry, e or a. So demo of this one, it's going to be o, o, You'll have to forgive me, I'm a little bit airy today. But you get the idea of how it works. And then letter C, once the students are comfortable doing that slur in the fifths, then you're going to do the same thing, but you're going to add in the re, mi, and fa on those. And you're going to do it 3 times, and it's fast. So you're going to go o, o, nice and easy. That should be a warm-up that you use throughout the year, and take it slow. There's no time, no rush on this. Next is vocal acrobatics. When used correctly, can expand a singer's range and their agility. So the one I like to use most of the time for expanding range is called pinwheels. And we start with an A vowel on sol, then we slide up to high do and change to an ah on that high do. And then we carry from high do down to sol, mi, and low do. And it's fast. And you're meant to move up the keyboard in half or whole steps to expand the range higher. So here's what this one sounds like. A, ah. Okay, simple, easy. The one I like to use for agility is E-A-A. You alternate the E and the A vowel on the first, 1, 2, 3, 4, 5, 6 little repetitions. And then on the 7th, when you change to the ah. This one is meant for agility, not necessarily range. So this one sounds like E, A, E, A, and then you would move up or down the keyboard by half steps or whole steps, depending on what you are looking for. But the key to doing that one is to do it fast. Teaching correct technique is what sets us apart as excellent voice teachers or choir teachers. Correct technique should be taught all through a rehearsal, from breathing exercises and warm-ups all the way through to cool down. Teaching and rehearsing proper technique can help prevent many vocal injuries. Teach and model the correct way to practice and rehearse. You don't want all that technique you've just taught to go to waste. Show students how to use it while practicing too. Having age and ability appropriate practice requirements is hugely important. Although I'm a trained classical singer, Dr. Wee wanted me to practice for only about 10 minutes each day so as not to upset my injury any further. Cool downs offer a structured way to relax the vocal mechanisms after a period of intense activity. You can use any of the warm-ups that we demonstrated earlier, or you can use this one. It's just called do. You say the word do with a good strong D, and it's nice and smooth like going down a slide. You start on sol on the D above middle C, an octave above middle C, and you go down to do. So it's do, and you work your way down the keyboard by half or whole steps. Nice, good, strong D, slurred oo all the way down. As teachers of an internal instrument, depending on the health of the body, we should also be teaching and encouraging good hygiene and health habits. Most of these examples here we know we should do, but we just don't. Continued reminders help us and help our students. I hope that this presentation has been instructive and interesting. I enjoyed very much researching this topic and putting it together. I believe that the more we know about common vocal injuries like these, the more we can be a first responder of sorts and help prevent more serious injuries. This slide lists the people that have been remarkably helpful in my journey and the sources I used for this presentation. Thank you.